Hey, it's Dr. Dave Candy. A common problem that we hear about is back pain or sciatica while driving. So if you get back pain or sciatica while driving, then this video is for you. Click the subscribe button at the bottom of this video to get notified of our future posts. Now, if you get back pain and sciatica while driving, one of the most important things is your position of the seat relative to the car and the steering wheel, as well as your position within the seat. So I'll go over a couple of tips for both of those things today. The number one thing is your backrest. You want to make sure that you have your low back all the way flat against the backrest. I'll slide the seat up here just a little bit so you can see better, but you want to have your back all the way flat up against the backrest. A lot of people have a lumbar support in their car that'll kind of come out like that. And that's okay for some people, but you don't want a lot of arch in your back while driving. You want to actually allow yourself to sink back into the backrest. So try it with the lumbar support on, try it with the lumbar support off, and use the one that feels better to you. But don't just put it on because you have back pain and you're supposed to use lumbar support. Do what feels better to you. The other thing is your seat back position. That putting your seat too far back, reclining backwards, like this when driving, puts a lot of stress on your low back, particularly if you're slouched down and not well supported by the seat. So trying to get your backrest as upright as possible, as close to 90 degrees, can be helpful. Now, slide the seat back again. You also don't want to be too far away from the steering wheel. You obviously don't want to be right up on top of it, but if you're too far away from the steering wheel and your back's at 90 degrees and your leg is really, really far extended out like this, that puts the sciatic nerve, which runs from your brain down your back all the way down the back of your leg, on a lot of tension. So if you're really reaching to get to the gas pedal, chances are your back's not going to be well supported and your sciatic nerve is going to be on a lot of tension. So get that seat, scoot up in the car. Now, the next thing to look at is your position within the seat itself. That if you kind of tend to sit off sideways or lean over on an armrest like that, you want to make sure you're sitting square on both sides. Because if you shift too much weight on one side of your hip, you're putting a lot of pressure on your buttock muscles, which is right where your sciatic nerve runs. So try to sit as squarely as possible in the seat, have the seat at 90 degrees, and have the seat close enough to where you can have some bend in your knee and you're not really far with your leg extended out straight. Now, the final thing to look at is your knee position. That a lot of people with sciatica, they have tightness in their hip external rotators, which are muscles back in your buttock. The piriformis is the one that always gets the bad rap. But those sit right over your sciatic nerve, and turning your knee outwards a little bit when you're driving to rest it up against the door or the one that's on the gas, turning it out a little bit so that you're pushing more on the outside of your foot rather than on the big toe side of your foot, can help take some pressure off your sciatic nerve and off your hips and buttock when you're driving. So those are a couple tips to prevent back pain and sciatica while driving. If you found this post helpful, click the subscribe button at the bottom of the video so that you get notified of our future posts. Thanks and have a great day.